Allergies and strep throat are two distinct conditions that often confuse people due to some overlapping symptoms. Allergies are the immune system's response to a harmless substance like pollen or pet dander, leading to symptoms such as sneezing, itching, and runny nose, whereas strep throat is a bacterial infection causing sore throat, pain when swallowing, and fever. The treatment for allergies often involves antihistamines or avoiding known allergens, while strep throat requires antibiotics to eradicate the streptococcus bacteria. Allergies can be exacerbated by environmental factors and genetic predisposition. Meanwhile, strep throat risk increases in crowded environments, particularly among children and adolescents. Understanding these conditions' nuances can help in identifying the right course of action and obtaining relief from their symptoms. Here's a detailed look at the contrasting aspects of allergies and strep throat. Affected systems, immune response versus infection. Allergies and strep throat, while both may trigger sore throats and discomfort, activate different arms of the immune system. Allergies are immune responses to benign substances perceived as threats, leading to histamine release and inflammatory symptoms like itching, sneezing, and runny nose. Strep throat, caused by the bacterium Streptococcus pyogenes, summons a more direct immune attack to combat the infection. This bacterial assault can cause fever, severe throat pain, and swollen lymph nodes, symptoms less common in allergic reactions. Distinguishing between the two is crucial for treatment, as antibiotics are warranted in bacterial infections like strep, but are ineffective against allergic reactions, which are managed with antihistamines and allergy control measures. Symptom onset, gradual versus sudden. Allergic reactions in strep throat can present similarly, especially when considering throat irritation and discomfort. However, a key differentiator lies in the symptom onset. Allergies typically manifest gradually as the body's immune system reacts to environmental triggers such as pollen or pet dander. Symptoms like sneezing, itchy eyes, and a runny nose evolve over hours or days. In contrast, strep throat, caused by the bacteria Streptococcus pyogenes, unfolds suddenly. Patients often report a rapid onset of sore throat, fever, and swollen lymph nodes, usually within hours. Recognizing this distinction aids physicians in selecting the right tests and treatments, ensuring patients receive appropriate care without delay. Pain level, itchy sensation versus severe throat pain. When distinguishing between allergies and strep throat, the pain level experienced by the patient can be a key indicator. Allergies often present with an itchy sensation that affects the eyes, nose, and throat, and this discomfort usually manifests without severe pain. It's a persistent annoyance characteristic of the body's reaction to various allergens. In contrast, strep throat typically involves intense and acute throat pain, which can significantly hinder swallowing and may be accompanied by fever, swollen lymph nodes, and white patches on the tonsils. This bacterial infection requires prompt medical attention and a course of antibiotics, whereas allergies are often managed with antihistamines and avoidance of triggers. Response to medication, antihistamines versus antibiotics. When distinguishing between allergies and strep throat, their response to different medications is a key diagnostic tool. Allergies, driven by the immune system's response to harmless substances like pollen or pet dander, typically respond well to antihistamines. These drugs mitigate allergy symptoms by blocking histamine, a compound released during an allergic reaction. Conversely, strep throat is a bacterial infection caused by Streptococcus pyogenes and requires antibiotics for treatment. Antibiotics target the bacteria directly, helping to eliminate the infection. Notably, antibiotics are ineffective against allergies, and similarly, antihistamines do nothing to alleviate strep throat because they don't address the underlying bacterial cause. Thus, observing how the condition responds to either treatment can significantly inform a healthcare provider's diagnosis. Associated symptoms, sneezing versus fever. When distinguishing between allergies and strep throat, one of the key symptoms to consider is the presence of sneezing in allergies, which is rarely associated with strep throat. Allergies often come with an array of respiratory symptoms like sneezing, runny nose, and itchy eyes, which are responses to allergens such as pollen, dust, or pet dander. In contrast, strep throat, caused by the streptococcus bacterium, typically presents with a high fever, a symptom that is generally absent in allergic reactions. This fever is a systemic response to infection, often accompanied by painful swallowing, red and swollen tonsils, and sometimes white patches on the throat. Identifying these symptoms can lead to an accurate diagnosis and appropriate treatment, whether it be antihistamines for allergies or antibiotics for strep throat.